Hello. So for my presentation, I will be focusing on the impact of sleep deprivation for the labor workforce, an analysis of the health consequences, as well as a societal impact. So to begin, how do we define the labor force? According to the article posted by Oxford Academic, at least more than 22% of workers around the entire world work more than 48 hours a week. More than 243 studies were published between 1998 and 2018, which was collected by a meta-analysis report that will be used in this presentation. And some of the ways that we split the way that we talk about the fields of work have different terminologies. So white collar means management work or professional work. Pink collar are service jobs, thinking about teachers, nurses, and blue collar jobs are physical and manual labor work. And they're all considered within this report as well as other reports that I found. This issue, as the labor force, does not only apply to the United States, but a lot of the publicized studies are coming from other countries such as Japan, Korea, the United Kingdom, as well as other countries that have done this group of study, because work has been a problem to not only people's sleep, but their health and the work that's being produced in these countries. So, how long has this been a concern? Well, this is something that has been going on for almost 2 centuries. We know that from one of the presentations that was given in the Gen Ed 1080 that was ran by Dr. Schleiser in 1877, the first American general workers' strike occurred. In 1884, there was the National Federation of Organized Trades and Labor Union, which called for 8 hours during the workday instead of the work schedule that was in place. Many businesses having varying degrees of work, even till this day, some requiring 12 hours depending on the discipline. And in 1938 and 1940, Congress created and amended in 1940 the Fair Labor Standards Act. The original act had 44 hours, but in the amendment, they made 40 hours per week for work the minimum mandate. So overtime was still possible. However, no businesses could schedule a person over those 40 hours. These practices, however, even though they were supposed to help people be able to have enough time for rest, were not enforced in all industries. The only industries that are enforced by this are done by the Federal Work Program, and they're safety sensitive occupations. But one example of a workforce that does not follow this is the medical industry. So the Accreditation Council for Graduate Medical Education has standards that last up to 30 hours for consecutive work and as well as 80 hours per work week, depending on the demands of the hospital or the place that some of these doctors or training are working at. So the reason why we're looking at sleep for laborers particularly has to do with the fact that we are having impact not only in the productivity of some of these companies, but in the health of these workers. We're seeing long-lasting effects that not only affect them, but can also affect their families, their health, and many other outcomes as well. So to quote one of the results section of the review of an epidemiological study. One of the outcomes for sleep deprivation, or many of the outcomes, include mortality, circulatory disease, diabetes, metabolic syndrome, depressive state, anxiety, other psychological disorders, sleep conditions, cognitive function, and health-related behavior. All of this in tandem work together to not only decrease the health of someone, like the personal health of the worker, but as well as impact their family. So for example, if you are an employee working long hours and you're seeing a decrease in your cognitive function or ability to be able to focus, you may be more likely to be in a car accident, or you may be more likely to come home if you are a parent and not be able to fulfill the demands that your household may need. So not only do we see this impact for the employee, we're seeing it on the household level as well. Some of the health consequences include, but are not limited to, a higher blood pressure, as well as an increase in glucose and insulin, which causes diabetes and obesity. But other research has shown that a lack of sleep or the lack of melatonin production in one's body can actually increase the risk of cancer as well. And one of the many reasons that this study or these studies in general should be looked at, if it's going to be looked at from the corporate America side, is that a lot of evidence has shown that productivity is increased when you give your workers rest. One of the amazing studies that I got from the Center of Medicine and Health Reports, CMH is the acronym, has a graph where they outline the amount of adults that are sleeping less than 7 hours. And the break, they separated gender, but they also tallied it in total. And the amount of adults who are adults in a two-parent family that are sleeping less are raised up by like 30%. But even being a single parent, which has more of a drastic impact in terms of your sleep schedule, we're seeing percentages above 42.6%, and 43.5% for women specifically. Some of the solutions that I think would be extremely impactful when thinking about how to help mitigate the challenges that workers are facing for sleep is, I believe, a work mandate of weekly hours should be dropped to 35 and enforced in all disciplines of work. Now, the current issue with this is that there are many industries that, even though they can reduce the work hours or their work hours are 40 hours per week, that the schedules or the mandates, depending on their employees, um, these these work hours aren't necessarily being enforced. They're being recommended, they're being passed, they're being put into acts such as the Federal Work Act. However, they're not being enforced, they're not being checked. So there has to be a system of enforcement in place, whether that be yearly federal checks or whether that be checks in terms of employment records and the hours that they're working, and holding businesses accountable in terms of management and not the employees for their work hours is very key. Another solution that can be really big and helpful is that workers can still elect overtime, however, limit the amount of work hours per week of overtime that they have. So if you limit the amount of overtime hours that a worker experiences within the year, you still are mapping out a way for them to be able to achieve the maximum amount of sleep, but also achieve the amount of income that they need to support themselves and their family. I can imagine one of the biggest pushbacks for limiting the amount of work hours per week is the fact that a lot of these employees are working these amount of times so they can be able to make their bills, so they can be able to make payments for either things within their families or their living situation, even food and eating. However, there are two different things that can happen. Either their wages can be increased, or if the wages can't be increased, still allowing overtime, but increasing the amount of money that they're able to make in that overtime can be really helpful. Just to mitigate the fact that there is every employee has a marker in terms of the amount of money they want to make per year. This, as an economic study, as a study in which we crunch the numbers and put it down in terms of making it effective for their work and for their financial outcomes, if implemented correctly, can allow us to find the perfect solution of work hours per week that don't go over 40, and also allow them enough time to rest and allow them enough time to commute from work to be able to rest, and allow them enough time to do the things that they have to do in their day aside from resting. And last but not least, the last solution is switching from a 5-day week to a 4-day week for certain jobs. I believe these jobs can include white collar jobs. Pink collar jobs can be a little bit more difficult, We're still following a 5-day week for school, so teachers may not be able to do this, and as well as service jobs that include nursing or even jobs within the hospital industry. They do require a 24/7 rate of attention. So it may be harder to switch to the 4-day week, but there are a lot of jobs that can, and we can end up increasing the rates of or the lack of rates for the health risks in a lot of different people in our population. And by creating more income for blue collar work, we would see a decrease in employees that need to work overtime or that are working overtime, and be able to see that the impact of this specifically not only will increase their health, but would possibly increase the level of production in their field of work. So, who and why will this help? What is the potential pushback? I kind of already talked about the pushback from employees, but one of the many pushbacks from companies is that many of them do not want to sacrifice their autonomy in work production. For example, truck companies, even though they do have a mandate in terms of work hours, they do not want to install technology to record the amount of driving hours that they're having their truck drivers work, because of the fact that it would take away the company's agency per se. However, there, like I mentioned, is also pushback from workers as well. So the pushback from the truck association itself is also coming from the fact that workers don't want to have a limit in terms of their overtime and the amount of money that they're making, because that money is what's substantially providing for their families. And a lot of people don't consider the fact that yearly annual bills are not the only expenses that people consider. When having a family, parents are considering vacations, they're considering experiences for their children, they're considering experiences with their spouses, and there's a lot more expenses that is put into an annual report that is not necessarily seen when just conducting an economic report of rent, food, and amount of income. One of the many things that was also talked about in the Gen Ed lecture was about the international legislator that led to an 8-hour working day and the 48-hour working week. This specifically was instituted in 1919. Having already been 100 years, we're seeing multiple reports, like I said, from 1998 all the way to 2018, 243. All of these reports are talking about not only the health risks and the percentage of the health risks that these people are experiencing, but also the fact that there is a huge impact on the ability for these workers to reach work, the ability for these workers to have healthy lives mentally and physically, and be able to sustain their level of work for the amount of time and years that they're doing so. Um, we are seeing that lower working hours per week not only allow the workers to achieve maximum rest, but some of the many factors that are included in this is better mental health, their cardiovascular health is improved, blood pressure is increased without sleep. And additional to that is, like I mentioned before, the decrease in other health risks that haven't been necessarily researched as much or have finding in. But if melatonin has a great impact in terms of decreasing the risk of cancer, and throughout these recent years with technology, cancer having become propagated within younger populations and having a higher rate of presence in the population, we are seeing that with the rise of technology, with lights that keep people up, that sleep function as itself suffering is causing health impacts on all varying levels. So, what do we do now? How are we able to get these solutions implemented? How can we change our work hours? How can we change the amount of days that we're working per week? One of the many things that I advocate for extremely is we must reach out and lobby to our local representatives and senators to advocate for work policy changes. These are not issues that are being brought up enough in the center government that we have established. In many town halls, we hear teachers speaking about teachers' rights or specific work disciplines talking about the fact that they're not being paid enough to be able to survive or even live in their communities. However, if this issue is not brought to the attention of local representatives, we won't be able to turn it into the larger national issue that it once was and still is. The reason why the attention was brought to Congress was because national strikes were being taken place. Things were happening for years on end, and it did not all happen in the same time. So a lot of these changes took 20 years, this beginning in 1877. They took over 30 to 40 years to happen. So in order for us to achieve the changes that we want to see, we have to be able to put in the work to advocate to our representatives as best as possible. Another one that I think is extremely important is the lack of sleep for laborers is intrinsically tied to the economy. There has to be economic research done, spread between the levels of work, blue, pink, and white collar, and also show the benefits of mandated less work hours on the employees' health and how workers can receive overtime pay with better fair wages. The math is there, the way that we see these industries and how they're constructed. We know the limits of the money that's accessible to be paid out to workers. However, what's not necessarily being calculated or clear is depending on how we change the scales, whether increasing wages, decreasing the amount of time of overtime, or decreasing the amount of workly hour weeks and increasing wages in a different way, we can find a solution that works to improve the health of workers, but also still maintain the economic the economic conditions of businesses as well as the country. And lastly, public health officials must advocate for sleep propensity. I believe as a person that has taken this class and has learned so much from the research and the sources that have been provided with for this report, looking at articles that are published by doctors such as Vashuri, Banu Prakash, Kim, and Dr. Violanti, there are many health officials, many doctors that are doing the research and care about this issue. However, on a public health level, this has not been made aware or been brought to the forefront. We do not see this as a topic being discussed in worker union meetings. We're not seeing this talked about in on the news. For many Americans that are experiencing jobs where that aren't sacrificing their sleep, this issue does not seem to be one that is sensible, one that can possibly happen because of all the changes that it would have to happen within the economy. However, if public health officials were able to put enough pressure onto our representatives, onto the people that are making these decisions to change these mandates, the proof is here. The proof is within the case studies, the proof is within the numbers of people, and the proof is within the documentation that has been happening over the last 20 years. We just need the right voices to make advocacy work.